For the 10th year in a row, Pennsylvania has reported more Lyme disease cases than any other state. And 2016 saw a new record for cases, as the Keystone State saw in excess of 12,000. Joining me now to look at Pennsylvania's Lyme disease situation is Amesh Adalja, MD. Dr. Adalja is a senior associate at the UPMC Center for Health Security. He is a clinical professor at the Department of Emergency Medicine, and he is a instructor of infectious diseases at the University of Pittsburgh School of Medicine. Hello, Dr. Adalja, and welcome to the show.
Hi, thanks for having me.
Yes, sir. Okay, so let's take a look at Pennsylvania. We see a record year as far as Lyme disease cases. I think last numbers I saw were about 12,200 or so. And your state has led the nation for at least a decade. So I guess my question is, how and why has Pennsylvania become such a hotbed for this tick-borne disease?
You have to remember that Lyme disease is a complex infection that has to do with the environment people live in, access to ticks, and access to other vector species, like, for example, rodents that may be mice, for example, that may be also part of basically the ecosystem of this disease. And in Pennsylvania, although people think of it as just Pittsburgh and Philadelphia, it is a very rural state, and there are a lot of wooded areas, and people take part in a lot of activities outdoors. And this tick, the tick is endemic in almost every county, actually every county
yes.
in the state, all 67 counties. So it's something that you can't completely avoid. And the other thing is we are very aggressive at testing here. It's something that's routinely done now. For example, in an emergency department, someone comes in with an undifferentiated cluster of symptoms, a Lyme disease test is often sent. So we are pretty good at picking them up, but we may be picking up things that are not really acute as well. There may be some overdiagnosis going on and old infections, but it clearly is something that really fits with what Pennsylvania looks like, and it's kind of prototypical for how Lyme has spread across the country.
Gotcha. So now nationally, there was, some 32,000 cases reported. And you probably remember back in 2013, the CDC came out with estimates that indicated that the number of Americans diagnosed with Lyme disease each year was around 300,000, so about 10 times what the yearly reported number is. So is it fair and reasonable to say that Pennsylvania likely saw 120,000 Lyme cases?
It's hard to pick the exact number of how many cases were undiagnosed, but we know that the number that are reported are gross underestimates in every jurisdiction because people don't necessarily fill out those forms appropriately. Data gets lost. Diagnoses aren't made appropriately. So I do think that we're really seeing a subset when you see what's reported to the CDC. And I'm not sure if it's 120,000 that we have, but I'm sure that there are more cases than are being captured by that data, which is the norm for almost every infectious disease reporting system.
Sure. Okay. Now, as we already talked about, the black-legged deer tick, the one that carries the Borrelia bacteria, has been found in all 67 Pennsylvania counties. As a infectious disease physician, what would you say to the Pennsylvania public concerning what to look for as far as early symptoms, just so they're attuned to it, and how to prevent Lyme?
I think it's important that people remember when they go into areas where the tick may be present in wooded areas, that they wear appropriate clothing, that they use appropriate tick repellents, and then they do tick inspections when they come back into the house or when they're outside of that environment, because we know that this isn't something that instantaneously is transmitted by the tick. It takes some amount of attachment, 48 to 72 hours, to pass the bacteria from the tick to the human. So as long as you're doing tick inspections, and they have to be somewhat meticulous because ticks like to get in places where you don't necessarily look, for example, like your waistband, you should be able to avoid it. But it is, it's sometimes hard, especially in children where you may not necessarily get a good level of inspection. But that's the best way to avoid getting exposed to the tick. And then usually with primary Lyme disease, you will see people develop flu-like symptoms and possibly one of those bullseye rashes that people in Pennsylvania are very attuned to, but maybe in other states where Lyme isn't as prevalent aren't as attuned to. But that bullseye rash is something very characteristic of Lyme and can really seal the deal on the diagnosis if you do have that, and then it's amenable to antibiotic treatment. So if you do have those kind of that kind of rash, it's important to see a provider.